Opioid abuse, a national public health emergency now. This will allow the government to redirect resources in various ways to fight the epidemic. Flanked by people on the front lines of opioid addiction, President Trump got very personal in his appeal. He even talked about his brother Fred's battle with alcohol.
He would tell me, don't drink, don't drink. And to this day, I've never had a drink. And I have no longing for it. If we can teach young people and people generally not to start, it's really, really easy not to take them. And I think that's going to...
All right, so a vulnerable moment from the president. The dope doctor Louis Delgado here to talk more about opioid addiction. And I want to start first with the president's announcement. Louis, right. Do you feel like this will make a difference? Well,
anytime someone's talking about this, it's making a difference. The stigma is so great on this, and that's what prevents a lot of people from not only understanding what's going on with themselves, but reaching out and trying to find out what kind of resources are available to get themselves help. So the president thinking about this, talking about this, putting focus on this. You know, everything Donald Trump says makes the news. So anytime he mentions the opioid crisis, I'm in love with it. All
right, so let's talk about opioids, because I still think that there are people who hear that word, Louis, right, and they don't know what that means. What is an opioid? And a lot of people have it in their medicine cabinet, don't realize it.
Right. You know the simplest way to kind of tell everybody what an opioid is it's, you know, whenever you think of something that you've been given to relieve pain, if you've ever had any kind of operation, procedure, from the dentist all the way up to outpatient procedures, inpatient procedures, whatever it was, they probably gave you something on your way out that they said this is to help reduce the pain or to help with the pain. Sometimes they'll give you a 7-day supply because it's just short term. Maybe you kept it, maybe you didn't. And sometimes your pain has gone on a little bit longer and they keep giving you refills, and you might have found that your tolerance may have went up, so they maybe give you something else that may to complement it or to give you a stronger dose of something. I would recommend that you go into your medicine cabinet and look for anything that says may cause drowsiness, and that's probably a good clue, and then go Google it. You know, we're all used to Googling something, so just Google it and find out if you have any.
Okay, so are there any street drugs that fall into this category?
Heroin. Heroin falls under that category. Okay. Those, you know, and that's the thing. Heroin, you know, methadone, Suboxone, and painkillers all have the same opioid parts in them. They may react a little bit differently depending if you're taking methadone and Suboxone, obviously, or buprenorphine products to help get off of it. That's different. It's just a little bit different, but it still has an opioid in it. So it's important to be aware when all those are in your home.
Louis, do doctors do a good enough job of telling patients how addictive these drugs can be when they prescribe them? I wish they did, to be honest with you. I don't think that the practice of medicine, the way that we were used to it, talks about that. It's almost as much as you hear about vitamins and exercise. It's like vitamins, exercise, and then you hear this may be habit forming, or nah, it's not a big deal, or it's not like that. So physicians just tend to just be working on what they're working on, and it's not against them. I'm not trying to out them or get on them. It's just not been their MO to educate you on addiction or dependence because they're giving it to you. So they tend to feel that they're in control maybe of you becoming addicted or not addicted, rather than understanding that there's genetic factors and environmental factors that kind of come into play right here. And there's also other substances that when mixed with this, it can be bad. You can't just depend on a little yellow label or a red label on your pill bottle to help the end user make the right decision. All right, Louis, unfortunately we're out of time, but I want to mention two things real quick. Walgreens is now offering Narcan at their stores. You can actually buy Narcan, which is something that will hopefully reduce overdoses. And I know that I think you're happy about that, happy to see that.
I'm excited about that. You know, a lot of people have said, by making Narcan available, does that make people use more opioids? And I say, well, that's like saying that having a fire extinguisher in your office makes people commit arson.
Right. Well, that's a good analogy. Okay, and last but not least, tomorrow is an important day, especially if you have some of these opioids in your medicine cabinet, right?
Yes, DEATakeback.com. It's Take Back Day. You get rid of them. You do not need them. If you're not going to use them, do not keep them. Okay, and just go to that website and it should have information about where you can drop them off. I think fire stations and police stations, there are some places around town between 10 and 2, is that right? Right, that's absolutely correct.
All right, get rid of them. Don't flush them down the toilet. Right. You don't want to do that either.
No.
All right. Louis, how can our viewers find you?
NowMattersMore.org. We love to help anybody that needs help. If you need help right now, give us a shout.
All right, Louis, you're the best. Thanks for being with us this morning. Still ahead on the news.